Joint mobilization of the cervical spine is an extremely powerful and effective technique, but must be learned very well and carefully before administering with clients. The first thing we need to do is locate our contact point. We find our contact point by first feeling for the spinous processes in the posterior midline of the neck. We drop lateral off of that and we'll feel the musculature, primarily the transversal spinalis musculature over the laminar groove. We continue laterally, anteriorly, and then we feel for broad, flat bone underneath the skin. These are the facets, or the articular processes of the cervical spine. They will be our contact point. If we go too far anterior and laterally, we would be on transverse processes. Transverse processes are very pointy and sensitive and would be very uncomfortable for the client if we place pressure on them. So instead, our contact point will be the articular processes, the facets of the cervical spine, right about here. To find the facets or articular processes of the cervical spine for joint mobilization, it's very helpful to use a plastic skeleton model. If we go dead center posteriorly, we find the spinous processes. If we drop laterally and anteriorly off, we are over the musculature, over the laminar groove. This is primarily the transversal spinalis musculature. If we then continue even further, anteriorly and laterally, we will then find the facets, or articular processes. These are broad, flat bone and provide the most comfortable contact point for joint mobilization. If we were to come even more anteriorly from there, we would then be on the transverse processes, which are very pointy and would be very uncomfortable for the client if we exerted pressure here. So it's very important to first find the spinous processes, drop into the musculature over the laminar groove, and then continue until we feel the broad, flat bone of the facets or articular processes. The position of the support hand of the client's neck and head is very important. It needs to be placed around the client's ear. We should not cup on top of the ear. That would be very uncomfortable. Further, it's important that our thumb is not on the mandible of the temporomandibular joint, the TMJ. So again, we want to cup around the ear. Then when we rotate the client's head into our support hand, we comfortably have the client's head in our left hand, the support hand. The client is being held gently but firmly and securely. Now that we've found the articular processes contact, we rotate the client's head and neck to the opposite side, approximately 45 degrees, into our support hand. We then have three choices for contact on the articular processes. We can use our thumb pad. We can use the finger pads, usually of the index and middle fingers. Or we can use the radial side of the proximal phalanx of the index finger, coming in against the articular processes here. Now that we've found the articular processes as a contact for joint mobilization, and the client's head and neck are resting comfortably but securely, rotated to the opposite side, in my support hand, we can perform the joint mobilization. The joint mobilization is performed in three steps. We will first press against the articular processes. We will then bring the head and neck above that point, around that pinpoint until tension is reached, and then the joint mobilization force will be applied. Showing that now, we press into the articular processes, we go around until tension is reached, and then we apply the joint mobilization. The joint mobilization can be applied in 3 different ways. We can press in this case with the finger pads, or we can pull the head and neck around the finger pads, or we can do both. Using the thumb contact, it would be shown this way. 1, 2, 3, or 1, 2, 3, or 1, 2, doing both 3. Using the contact on the proximal phalanx of the index finger, it would be 1, 2, 3, or 1, 2, 3, or 1, 2, 3. Now that we know how to perform joint mobilization at one level, we would then apply that technique across the entire cervical spine from inferiorly to superiorly. So it would be performed like this. Once we've performed joint mobilization for one side of the neck, we would then perform it on the other side of the neck. A nice way to do joint mobilization is to do it sequentially from left side to right side, right side, gently in a rocking kind of motion like this. For some therapists who tend to be a bit timid about performing joint mobilization, this method of doing joint mobilization is often very well liked, and often very well liked and received by the client.